Okay, good morning, everyone. It is 8:30 on Monday morning, and it looks like we've got a few people joining us for the kickoff of our HSD customer listening sessions. This is the first of 4 scheduled listening sessions that the department is launching to get feedback from our customers, and that includes really everyone that the department serves. We are very interested in hearing from you all about how HSD is doing and what we can do to improve. So before we start, let's go ahead and do introductions. I'd like to welcome all of you. We've got Angela Madrano, our Deputy Secretary, here joining us, our fellow Deputy Secretary. We've got Carmela Martinez, the Director of our Income Support Division, who's going to help me with the presentation this morning. Sean Pearson has joined us. He's our Chief Information Officer for the department. Ryan O'Connor, who works in the Secretary's office, is going to help with presentation logistics and timekeeping this morning. And then we've got Sally Jameson, who is also a member of our Office of the Secretary's staff, who's going to help with record keeping and monitoring our chat box this morning. And we've got Ashley Espinosa, the department's Public Affairs Coordinator. And we've got Audrey Cooper, who is an HSD Policy Fellow and registered nurse who's going to help facilitate the questions today and request feedback from the audience. So that's the HSD staff, and I am Carrie Armijo, also Deputy Secretary of the Human Services Department. So welcome and thank you for joining us early on a Monday morning to kick this off. We're really excited to hear from you all. Before we get started, I'm just going to go over some brief ground rules for the presentation. I wanted to let you all know that the presentation is being recorded, and we are interested in posting these on YouTube with closed captioning so that we can provide the session or make it available in alternative formats for individuals who aren't able to join us today. And so it will be available on a later date on YouTube. So individuals should know that this session is being recorded. In order to keep the session manageable, everyone but the presenter is going to be muted. Comments are going to be submitted in the chat box during the presentation, and then we can open up the session to hear feedback from the audience, at which point we will unmute you to offer input. If you already have a comment now, please feel free to submit that in the chat box, or you can wait until we've opened up the session for audience feedback. At that point, if you'd like to speak, just tell us in the chat and we will unmute you. We want to make sure that everyone has a chance to speak, and so we'll make sure that we give everyone enough time for discussions. We're going to ask that people keep their comments to no more than 1 minute. We may be able to extend that if we don't have a great deal of folks on, so we'll just keep an eye on the time and adjust accordingly. Questions about or feedback about specific issues, such as a personal issue that you might have that needs to be resolved, for example, around eligibility or provider payment, may require some additional follow-up from HSD staff before we can answer. So we do plan to capture your question and your contact information and plan to follow up with you after the meeting is over if we need to follow up on anything specific for you. We want to encourage and maintain a respectful environment for the session for everyone who's involved in today's session. So just a reminder to be respectful in your comments. Thank you. Okay, we're going to go ahead and get started. So Ryan, can you please advance the slides? Okay, so as I mentioned today, the goal of the listening session, we're going to talk about those goals specifically. We're going to review some recent changes that HSD has made in terms of how we interact with customers, in terms of field office operations, behavioral health and Medicaid changes, and then of course COVID-19 emergency operations. Many of those changes have been driven by the emergency, but we're very interested in capitalizing on this opportunity to see what we can do better to change things for our customers. And then we're going to really spend most of the time today taking questions and getting feedback from the audience, or giving questions and asking for your feedback on those questions. We're really mostly interested in hearing from you and not talking very much today. So next slide, please. We wanted to spend a little bit of time this morning talking about HSD's mission and goals. One of the first priorities of this administration that started in January of 2019 was to create a mission statement and goals that would reflect the priorities of the new leadership and the department, and which would guide our work over the next few years. So I want to spend a little bit of time reviewing these. These are really driving all of the work that we do, and we want to make sure that all of our work is connected to the mission and the goals that we have set forth here. HSD's mission really is to transform lives. We view our work as essential to working with our partners to design and deliver innovative, high-quality health and human services that improve the security and promote independence for New Mexicans in their communities. That is our mission, and the goals that we have set forth to support the mission are, number one, we help New Mexicans. That is why we are here. That is why all the staff are here. That is our priority every day. We want to improve the value and range of services we provide to ensure that every qualified New Mexican receives timely and accurate benefits. That is goal number one for us. Our second goal is to make sure that we communicate effectively. We want to make sure that we create effective, transparent communication to enhance the public trust. Part of that is what we are doing here today, but we want to hear more from you about how we can be sure to communicate effectively. Third, we want to make access easier. We want to successfully implement technology to give customers and staff the best and most convenient access to services and information. So again, we want to streamline things for customers and make it easier for them to get benefits and services. And fourth, we support each other. HSD wants to promote an environment of mutual respect, trust, and open communication to grow and reach our professional goals with HSD staff. And so those are we want to make sure that everything we do this morning and all of the questions are really tied to the mission, and making sure that HSD is getting feedback from you to make about how we can meet our goals better. So that was really the purpose of these sessions today. Next slide, please. Okay, so today what we want to do is receive feedback about how well HSD is meeting its mission and goals. We want to hear from our customers about what we can do to improve our business processes. We want to learn what we can do to make it easier for customers to access the services we offer. We want to listen to input about how we can improve, and we want to find out the best ways to communicate with our customers. So again, we're doing some talking at the beginning, but we really are hoping to hear from all of you about what we can do better. Next slide, please. Okay, so these are the questions that we're going to run through, and we're going to ask these toward the end after Carmela has finished presenting. We're going to hand this over to Audrey, and she's going to ask these questions of you. So we're going to ask them now so you can get them going and percolating in your minds, and then we'll open it up for feedback on these questions later. We want to know what is going well at HSD. If you could change just one thing at HSD, what would it be? What innovations do you suggest for improving HSD? How can HSD make it easier for our customers to access our services? And how can HSD improve its communication with them? Next slide. Okay, I am going to hand it over to Carmela Martinez, who's going to talk about changes that HSD has made more recently to enhance customer service delivery and partly to address the COVID-19 pandemic. So Carmela, you're on deck.
Good morning, everybody. Is my volume okay? Thumbs up. You can hear me all right, Carrie, Aubrey? All right. So I'm really glad to be here this morning. So we're going to talk a little bit about, I don't think anyone can deny or argue that COVID-19 has drastically changed the landscape of how New Mexico does business. However, HSD remains committed to helping New Mexicans receive the benefits and services that they need during these trying times. HSD has worked with their federal partners for all programs of assistance to implement waivers that offer flexibilities for existing eligibility and reporting requirements, as well as expanding access for new applicants. These flexibilities enable HSD to implement precautionary safety measures without potential negative impact to our customers. On the next few slides, we're going to talk a little bit more in detail about what that really looks like. So one of the things that we've done is new approaches to our field office operations. We've modified our service delivery model and increased call center staff and online application ability at our income support division offices. And HSD has used this public health crisis as an opportunity to see how we can expand access to service and benefits. On the next slide, Child Support Enforcement Division, again, has also taken this opportunity to modify their service delivery model, offering curbside services. They've collaborated with the local courts in New Mexico to come up with new and unique ways to be able to support their constituents during this time. And they've actually started an online payment program so that persons don't have to leave their home and still meet their child support obligation. On the next slide, we're going to talk a little bit about behavioral health. Health and safety of employees and customers is a primary goal while continuing to provide critical services at behavioral health. So what they've done is they've enabled a telephonic visit, and they've established the New Mexico Crisis and Access Line. This line supports individuals and communities during this time. This service delivery model has prepared us to appropriately respond not only to mental health concerns, but also the COVID-19 coronavirus outbreak. This line offers professional mental health services and access to resources. On our next slide, we're going to talk about Medicaid. Medicaid has really worked hard to streamline the application process, as well as ensuring that New Mexicans receive a continuity of service. And we see such examples of this with our Yes New Mexico real-time eligibility online application process. So persons can go online, they can go to Yes New Mexico, and they can actually receive a determination for Medicaid eligibility in real time, so long as we're able to have all of that information. If internet access is an issue or connectivity, you can also call our customer service number, and we can take that application over the phone for you. Another example of continuity of services is their introduction of telemedicine to be able to support persons without them leaving their home. On the next slide, we're going to talk a little bit about the Emergency Operations Center. During the public health crisis, strong partnerships have been leveraged to provide support for New Mexicans during this unprecedented time. HSD, along with other state and nonprofit agencies, have successfully provided emergency support in the following areas. Food services, and to highlight here, approximately 25% of the state's food supply was afforded via this effort. We've also supported shelter, non-medical supply distribution, and behavioral health services. Thank you so much for your time. This is just a brief recap very quickly because we want to make sure we afford enough time for everyone on the line to provide their input to the questions that Ms. Armijo just went over. So without further ado, I'm going to hand it over to our moderator for the rest of this, Ms. Aubrey. Thank you so much, Audrey.
Thank you. Thank you so much for participating today. I want to go over a couple of the ground rules before we begin our questions that Carrie outlined. Each speaker will have 1 minute to give feedback for their question, and we'll cap each question at about 10 minutes of participant feedback. In order to share your feedback, please indicate in the chat box that you'd like to share a comment, and we will unmute you. Otherwise, the rest of the participants will stay muted to give you uninterrupted time to share your feedback. So we can have the first question. What is going well at HSD? So who would ever like to answer, you just type your name in the chat box, and you'll see that Ryan O'Connor typed welcome everyone and thank you for your participation. So it's down at the bottom. And we'll give about a minute to think over your response.
So Audrey, this is Angela. May I make a suggestion for the team? Perhaps we can, since we have a smaller crowd this morning, perhaps we can unmute the participants and see if so that make it a little bit easier for people to ask questions. How does that sound to everyone?
That sounds great to me. So what we'll do is we can have folks share, and then if someone's talking, we'll just wait until they're finished after a minute, and the next person can go. Okay, so we have a question. How does a public service announcement help those that are suffering with substance disorders? With someone from...
Yeah, I think, and I'll let, thank you for the question, first of all, and thank you for getting it started. I know it's sort of difficult to be the first one to speak or ask a question in a session like this, so thank you for doing that. I want to start by just saying I think the goal of the public service announcement campaign is really to try to bring awareness to substance use disorder and alcohol use disorder. There had been some time, particularly with the COVID-19 emergency, where this has become even more of an emergency because of people's dependency and sort of the inability for folks to access the care they needed during this time, some uncertainty about what services were available, whether they could get care through those telephonic visits that we were talking about. And so we really want to just call attention to ways that people can get help during this time if they need help. And so that's really our goal with that public service announcement. Angela, I'm not sure if you have anything else to add.
I don't, Carrie. That was a great answer. And, just a slight caveat off the question, Behavioral Health Services Division also worked with the New Mexico Crisis Line, and that information was in the presentation as well, to make services, or at least the crisis line, available to anyone during this public health emergency. So that was some additional information we wanted to share.
Audrey, do you want to go ahead and move on to the next question?
Sure, that sounds great. Oh, we have another chat box here. Jennifer Swanberg. For public listening sessions, please include multiple means of accessing phone, mobile phone, computer, etc. Those who experience sensory and/or physical challenges use assistive technology, interpreters, have limited technological resources, or simply have broken sound card in their laptop, for example, are excluded from this important venue. Thank you.
Thank you for that feedback. I think that the department is working on what we can do to really make sure that we make these sessions as accessible as possible. As I mentioned, we are planning to put these on YouTube and with closed captioning. Given the remote nature of these during the COVID-19 pandemic, we are struggling a little bit trying to figure out what's the best way to do this. So thanks for the feedback. We'll take it and see if we can do anything to improve our accessibility for these sessions.
Okay, so I'm going to ask the next question. If you could change just one thing about HSD, what would it be? And you're more than welcome to speak or type in the chat box.
So I'd like to, I know, this is difficult, and I know that people may not feel totally comfortable, particularly in this format. And we do understand, and at the end of this, we're gonna offer some alternative ways that people can offer feedback to us, either through email or snail mail. But this is really your opportunity to tell us. And this is the magic wand question. If there's anything that we could change that you'd like to see us change, what would it be? We really do want to hear from you all about your priorities, about how the department can do better. But we do understand if it's difficult to speak up in this context. But hopefully we'll hear from some folks.
If persons feel more comfortable, I might, oh, sorry, Audrey, I know there's somebody in there, but if people feel more comfortable, they can also send the comment directly to Audrey, and she can kind of anonymously say, this is the comment or feedback that we received. That makes you feel more comfortable as well. But Audrey, sorry, I'll let you go ahead. I see that somebody just put something in the chat.
In the chat, there's a comment, and it says that, so if you could change just one thing about HSD, what would it be? And the answer in the chat is that as constituents, we see collaboration across agencies. Thank you for that.
Yeah, that's great feedback.
Would anyone else like to share their feedback?
Yes, this is Mary Collins. Can you hear me?
Yes.
Yes, I'm with the Clovis Area Transit System in the city of Clovis. And I think one thing that would help us out a lot is an immediate contact number with your department when we're transporting people over there for service. They don't know if they can get there or not, or get help or not before they get there. So if we were able to contact you to confirm that, then the trip wouldn't be in vain. That would help us out a lot.
Thank you so much for that feedback.
Can I ask one follow-up question, just to make sure that we understand the context of that question or the comment? Is that related to the medical services or to the vision?
No, we're public transportation. We transport anyone that needs to go over to ISD or anywhere else they need to go. And a lot of times they're not real sure if they can go in there for an appointment or whatever. So we can help them out by calling while we have them on the phone and confirm if they will be able to be seen. But right now we don't have no immediate contact number, so we can't help them out.
Okay, thank you for clarifying. That's good feedback, thanks.
Hi, if another chat doesn't pop up, I was kind of curious if the NLBHA user that indicated to see collaboration across agencies, is there a particular collaboration right now that you think maybe we haven't leveraged or expanded on that you think might be missing, like void? It would be great to know where maybe we need to improve those relationships. You can unmute yourself or you can add some information to the chat. I think that would be useful for me to see where we need to branch out. Thank you.
Carmela, in relation to Ms. Collins' comment, can you talk a little bit about the income support division's new lobby hours, and insert in the chat who the contact number is, what the contact number is in that area of the state?
Right, so I will place our customer service center. It is a statewide service, and they are prepared to support statewide with resources, etc. I'll also post some links in there on the on the chat that offers locations for where our offices are. You know, for health and safety, we prefer that you find other means, such as maybe phone or online. But if you do need to come into an office, we offer curbside hours. So we are open from the hours of 10 to noon. And this is the same thing for our joint child support offices that we share. And that way we can still offer services, and it's not quite so hot in the day, it's in the morning, but we can still do over-the-counter EBT cards. We can help you with paperwork or verification. We can answer your questions, but I'll put our contact information as well as the website, so you can also get applications online and locate an office near you. We have about 32 locations operating right now statewide during the pandemic.
Okay, would anybody else like to give feedback on the current question? If you could change just one thing about HSD, what would it be? Okay, seeing no additional feedback, could we go to the next slide? Okay, what innovations do you suggest for improving HSD? Okay, so we have a comment. Thank you for taking the time to get feedback from the public. HSD has been doing a great job in general communicating with the public via various means of communications.
Audrey, this is Angela. Just wanted to thank the attendee for that comment. Also, in relation to their previous comment about collaboration, wanted to mention how the Human Services Department works very closely with our Department of Health. We also partner very closely with our New Mexico Aging and Long-Term Services Department and the Children, Youth, and Families Department. In fact, the departments meet together on a monthly basis. So if there is an agency that you all believe that the Human Services Department could collaborate with more closely, please let us know. More recently, we have been working very closely with our Public Education Department to issue out additional EBT cards, SNAP benefits to households who have children who receive free and reduced lunch. And we're also collaborating with the newly formed early education department, childhood and education department. Did I get that right, Carmela? EC.
That's correct.
Early
childhood. Correct.
Yes. So please don't hesitate to let us know if there are other agencies that HSD can collaborate with more closely, because we are happy to do so.
Okay, we're still welcoming feedback on the question, what innovations do you suggest for improving HSD?
And for those who may have just joined us, just want to share with you all where we're at in this process. We're asking attendees to provide the department with feedback to the questions you see on the slides. So we're on question number 3, but welcome your feedback.
Carmela, would you like to just explain briefly again what you posted in the chat?
Gladly. So they should operate as hyperlinks. So you can see right there, we have our Yes New Mexico online application system. Constituents can apply for benefits, recertify their benefits, and report changes to their benefits, all from the comfort of their own home, local libraries, anywhere they have access, and the link is there. If persons prefer a paper application, you can go online, and the link is there to get a paper application available in both Spanish and English. If you'd like to find your local ISD county office, you can click on that link and it'll show you where the offices are. We share 5 offices with child support, and the remaining offices are standalone between ISD and child support. I also put some information in there around different communications and public information that might be useful right now. I placed our ISD call center number as well as our child support call center number, as well as the curbside office hours. So any office in the state, regardless of child support or income support, is operating at 10 to 12 daily. And again, we do take every health and safety measure. We ask that you stay in your vehicle. And if you maybe took public transit, we do have areas set up outside to be able to support you so that you don't necessarily have to come into the lobby, but that is an option should we need. And so we're being very creative to make sure that we can still afford a continuity of service.
Thank you, Carmela. Okay, any final input on what innovations do you suggest for improving HSD?
I will say this is like my favorite question because I really love this type of challenge to see how I can be best challenged to implement something in a new environment with maybe a new perspective. So this is my favorite question if y'all want to keep me busy. So don't be bashful.
Okay, it looks like we have a comment. A single portal for reporting adverse events and mandatory report. An internal determination of which state entities are to review the incident would reduce the administrative burden on providers and improve reporting to the appropriate entity and entities. And this is from Jennifer Swanberg. Thank you, Jennifer.
So Carrie, I'm going to kind of put Sean on the spot. You want to talk a little bit about how we could approach this or any ideas you have there?
Sure. So one of the initiatives we have at the department with several of our sister agencies is what we call HHS, or Health and Human Services 2020. One of the projects within that initiative is to take all the various portals, websites, et cetera, that we leverage across these agencies and create a unified one-stop shop for folks to be able to perform functions similar to what you described, Jennifer, in your chat. But with a primary focus on our customers, so that they don't have to understand the organizational structure or bureaucracy of state government to know where to get information that they need to apply for benefits, services, et cetera. So look for that to be knocking on our doors later this calendar year, early next year is our timeline for that.
Okay, I think we can move on to our next question. How can HSD make it easier for our customers to access our services?
Well, people are frantically typing. I will say that ISD takes this commitment to serving persons in their community very, very seriously. Ms. Armijo mentioned earlier when she was talking about our mission statement that we talk about how we want to provide innovative service and access to services to persons in their communities. So ISD has actively looked in their areas and their local counties and cities to find partnerships to see how maybe we can best service people that maybe we weren't getting to before. So it's an initiative that staff really enjoy doing. We'll probably have to modify the approach moving forward based off of health restrictions, et cetera. But if there's ideas about how maybe we can continue to service persons more regionally and specific in local community areas during this pandemic, that would be great. If you think there's populations that maybe we're not getting to, that would be great as well.
Thanks,
Yeah.
Colonel. Looks like we have.
Oh, go ahead. Good. Go
We
ahead,
have
Audrey.
a follow-up comment from Jennifer in response to Sean. Thank you. I think the customer services portal is excellent. However, providers have multiple venues and portals for reporting adverse events specifically. Other states use a single portal. When do we expect to see a single portal for reporting adverse events?
Well, I'll take that, Audrey. So Jennifer, I don't have a specific date yet, but let me take that back to our team and we'll get more information back out to you.
Thank you. I will reiterate the question. Oh, or Carrie, did you have something you wanted to add?
Well, it's really related to this question, Audrey. I just wanted, I wanted to reiterate, and I'm not sure if I mentioned this earlier, that the pandemic has really presented us with a lot of challenges, but it is also an unprecedented opportunity for us to change how we do business and how we serve our customers. It's caused the department to really rethink how we do business and to make sure that, we are not, we want to make sure that absolutely no New Mexican, who qualifies for our services goes hungry or without medical care that they need. And so, we've really had to think hard these past few months about how we can make sure we do that during this time. And so I'm not sure I said that earlier, but I just wanted to reiterate that point and, really see if we could get any feedback at all on this to, if there's anything that you all think we're missing, it would be so important for us to hear that.
Thank you, Carrie. So I'll reiterate the question. And if you would like to provide feedback, please either speak or you can type your feedback in the chat box. How can HSD make it easier for our customers to access our services? If you don't have any more feedback, we can move on to the next question. And I will be asking for final feedback at the end. So if you happen to think of something, this isn't your last chance. Okay. How can HSD improve its communication with you? Again, please feel free to speak or to use the chat box.
Is there a forum of existing communication that maybe constituents would like to see more of? And maybe we need to repeat something that we're doing well. That would also be very useful feedback for us as well. Thank you.
In addition, HSD has utilized extensively social media as a means to communicate with our customers. Ashley, our communications lead for HSD during this crisis, has been doing extensive outreach via our Facebook site, the HSD Facebook site. We have also posted a link on our HSD website asking customers to provide feedback to us related to the new way we've been providing services to you all, so that we can learn from your feedback, whether you're enjoying this new method of accessing services and are open. We also have a link on our HSD website for any input or feedback that a customer would like to give us.
Thank you, Angela. We'll give it another 30 seconds or so, and then you're more than welcome to include your feedback in the chat or speak your feedback. Okay, we can move on to the next slide. Do you have any additional feedback? So if you would like to answer any of the previous questions or simply give us feedback on areas that we didn't open up questions on, please feel free to use the chat box or to speak. And thank you to everyone who has given feedback so far. It's been very helpful to hear from you.
We have a quiet crowd today, Audrey.
I'm sure that they're contemplative, thinking really hard. Doing these kinds of sessions sometimes it's just as valuable for people to hear from other people participating as it is to share. And that's something that I've received feedback on. Okay, well, does anyone else have anything they'd like to share before we move on?
There's a comment, Audrey, in our box.
Is there a new one?
Yep.
Okay.
State agencies have done a great job with COVID-19 restrictions, keeping staff safe and customers while maintaining services. Thank you for that feedback. That is very nice to hear. As you all know, Secretary Grace is assisting the governor and Secretary Kunkel from the Department of Health in all of the state's efforts to contain the spread of COVID-19 throughout the state. And with that, it is extremely important to HSD that we are keeping our customers safe. So as Carmela mentioned early, we're offering, for those that don't have access to technology, we are offering curbside services from 10 to 12 in our each day, Monday through Friday, at our Income Support Division offices. And it is our goal to make sure that everyone stays safe. We have also provided our staff with masks and precautionary measures during this time. So thank you for that feedback.
Thanks, Angela, for reading the comment. I think we're all set on the listening session portion.
Yeah, thanks, Audrey. Appreciate that. And thank you, everyone. Ryan, can you go ahead and advance the slides? Okay, so we wanted to make sure that we give additional ways to offer feedback. We recognize that this might not be the forum that is most comfortable for some folks, so that's perfectly fine. The most important thing to us is that we hear from you. So in whatever way that you feel comfortable. So we are asking for feedback related to the questions that we asked today by Friday, July 10th. We are using this information to inform our strategic plans going forward, as well as the services that the department offers and evaluating sort of how we do business. And so the feedback is very important to us. We do have a customer service survey that is posted on our website. The web link is there. If you could please just take 5 minutes to go do that survey, that would be extremely helpful. And it's just a really quick survey to give us some feedback about your customer service experience with the department. We're also happy to take feedback over email. You can email us at hsd-publiccomment@state.nm.us, or you can send us feedback in the mail at our address here that's listed on the slide. So, and we will be posting the slide on our website. So you can mail this to the Human Services Department, attention HSD Listening Sessions, PO Box 2348, Santa Fe, New Mexico 87504-2348. Next slide, please. If you think of something and you really want to tell us during one of the future listening sessions, please feel free to do that as well. If you'd like to join another one, this is the first one. So, there are going to be more opportunities. There's going to be another session this afternoon, although that session is going to be facilitated in Spanish. Of course, all members of the public are invited to attend, but it is going to be done in Spanish with no translation to English, really. So that is the goal of that session, is to really get feedback from HSD Spanish-speaking customers as much as we can. And then we'll have 2 more sessions tomorrow. Again, tomorrow morning from 8:30 to 10 a.m. And then we'll be offering a session from 4 to 5:30 p.m. tomorrow evening. So please attend if you think of something after today's session that you would like to tell us.
Tell a friend about a future session if they'd like to participate and share the information.
Yeah. Next slide. So that is it. We know that it was a quiet group today, but we still thank you for your presence this morning and for being here. Just being here is support to the department and an indication of your interest, and we thank you for that. So we will go ahead and wrap it up, and just to thank you for joining us. We really appreciate it. Bye, everyone.